In this segment, we're going to treat somatic dysfunction of the cervical spine utilizing counterstrain technique for posterior cervical tender points. Now we have posterior cervical tender points pure midline or inferior lateral tips of the spinous processes or posterior to the articular pillars of the cervical spine. So to first find a midline tender point, we would palpate some from the occiput, palpate for the C2 spinous process, and the PC2 tender point is just superior to the tip of the C2 spinous process. The PC3 tender point is inferior to the spinous process of C2. The PC4 tender point is inferior to the spinous process of C3. The PC5 tender point inferior to the spinous process of C4. And I feel a little hypertonic area, and when I probe to the patient, we get a tender point response. So we're going to tell the patient to remember that, and we're going to quantify that as a 10, and then we're going to ask our patient to slowly try to bring his head and shoulders up toward the head of the table. And perfect, right there, and then relax. And then we're going to let the patient totally relax on my thigh here. And the classic position to alleviate this pure midline tender point, PC5, would require extension. But again, you don't want to hyperextend the occipital and articulation, so we almost want to press straight up and let that cervical spine fold around my finger into extension, and you'll feel the softening under your finger, and ask the patient, how does that feel? And hopefully the patient says it's a 0 or as close to 0 as possible. This may require some fine tuning, more or less extension, might require a little bit of side bend rotation away, but we find the position of optimal comfort. We hold it here for 90 seconds. And then after 90 seconds, of course, we're going to reposition back to neutral and reassess the tender point as well as the other components of the somatic dysfunction. Now, there may also be a tender point just inferior and lateral to the tips of the spinous processes. So we would check on each